Hello and welcome. Today, we're delving into the world of liver disease, specifically focusing on cirrhosis. Cirrhosis is a serious condition that progressively destroys the liver's ability to function. Let's explore what causes it, how it impacts the body, and what can be done about it. Cirrhosis isn't a disease that springs up overnight. It's usually the result of long-term liver damage caused by various factors. Chronic alcohol abuse is a major culprit, consistently damaging liver cells over years. Chronic viral hepatitis, specifically hepatitis B and C, are also leading causes as the virus continuously inflames and injures the liver. Non-alcoholic fatty liver disease, or NAFLD, is increasingly becoming a common cause, particularly with rising rates of obesity and diabetes. Less common causes include autoimmune diseases like primary biliary cholangitis and autoimmune hepatitis, genetic disorders such as hemochromatosis and Wilson's disease, and certain medications and toxins. To understand cirrhosis, we need to look at the pathophysiology. When the liver is repeatedly injured, it tries to repair itself. This process leads to the formation of scar tissue, known as fibrosis. As fibrosis progresses, it disrupts the normal structure of the liver, replacing healthy tissue with scar tissue. This scarring impedes blood flow through the liver, increasing pressure in the portal vein, a condition known as portal hypertension. The liver's ability to filter toxins, produce proteins, and perform other vital functions is severely compromised. This ultimately leads to liver failure and a cascade of related complications. Cirrhosis is a significant global health concern. The prevalence varies depending on factors like alcohol consumption, rates of viral hepatitis infection, and the prevalence of obesity and diabetes. In many developed countries, alcohol-related cirrhosis and hepatitis C are leading causes. However, the rise of NAFLD is changing the landscape, making it an increasingly prevalent cause, particularly in Western populations. Understanding the epidemiological trends helps healthcare professionals target prevention and treatment efforts. The signs and symptoms of cirrhosis can be subtle in the early stages, often making it difficult to detect. As the disease progresses, symptoms become more noticeable. Common signs include fatigue, weakness, loss of appetite, nausea, and unexplained weight loss. Jaundice, or yellowing of the skin and eyes, is a hallmark of liver dysfunction. Other symptoms can include ascites, which is fluid buildup in the abdomen, swelling in the legs and ankles, easy bruising or bleeding, and spider-like blood vessels on the skin. In advanced stages, patients may experience mental confusion or hepatic encephalopathy due to the buildup of toxins in the brain. Diagnosing cirrhosis usually involves a combination of physical examination, blood tests, and imaging studies. Blood tests can assess liver function, including levels of liver enzymes, bilirubin, and clotting factors. Imaging techniques such as ultrasound, CT scans, and MRI scans can help visualize the liver and identify any structural abnormalities. A liver biopsy, where a small sample of liver tissue is taken for examination, is often performed to confirm the diagnosis and assess the severity of the scarring. New non-invasive tests such as FibroScan are also used for assessing the degree of liver fibrosis. Cirrhosis can be classified based on its underlying cause, such as alcoholic cirrhosis, viral hepatitis-related cirrhosis, or NAFLD-related cirrhosis. Another important classification system is the Child-Pugh score, which assesses the severity of cirrhosis based on factors like bilirubin levels, albumin levels, ascites, encephalopathy, and prothrombin time. The model for end-stage liver disease, or MELD score, is also used to assess the severity of cirrhosis and predict the likelihood of survival. This scoring system is important for prioritizing patients for liver transplantation. Unfortunately, there's no cure for cirrhosis once significant scarring has occurred. However, treatment focuses on managing the symptoms, preventing further liver damage, and addressing the underlying cause. For alcoholic cirrhosis, complete abstinence from alcohol is crucial. For viral hepatitis, antiviral medications can help control the infection and slow down liver damage. Medications can also be used to manage complications like ascites, encephalopathy, and portal hypertension. In severe cases, a liver transplant may be the only option for survival. Prevention is key when it comes to cirrhosis. Limiting or avoiding alcohol consumption is crucial for preventing alcoholic cirrhosis. Vaccination against hepatitis B and practicing safe sex can help prevent viral hepatitis. Maintaining a healthy weight, eating a balanced diet, and exercising regularly can reduce the risk of NAFLD. Early detection and treatment of liver diseases can also help prevent the progression to cirrhosis. The prognosis for cirrhosis varies depending on the severity of the disease and the presence of complications. Early diagnosis and treatment can significantly improve the outcome. However, advanced cirrhosis can lead to liver failure, liver cancer, and other life-threatening complications. Recent research has focused on developing new therapies to slow down the progression of fibrosis and improve liver function. Studies are also exploring the potential of stem cell therapy and other regenerative approaches to repair damaged liver tissue. While these are still in the early stages of development, they offer hope for the future treatment of cirrhosis.